study in Australia suggesting the COVID-19 virus can survive on some surfaces for 28 days. That is much longer than previously thought. That showed the virus could stay on plastic for 6 days and money and glass for maybe 2 or 3 days. To help break this down, we have invited Dr. Isaac Bogosh back to the program. He's an infectious disease specialist with Toronto General Hospital. He joins us now in Toronto. Second time today for you to be with us, Dr. Bogosh, so I do really appreciate your time. You've had a chance to look at the study. What's your reaction to these findings?
Yeah, this study came out a couple of days ago. It's an interesting study. We've seen a few of these. Basically, they put some virus on some materials. They put it into an incubator, and they basically see if they can culture that virus or see if they can find viable virus a period of time afterwards. And the thought is, hey, what's the risk of getting infections by touching inanimate objects and touching our eyes, nose, and mouth? In this study, they were able to find viable virus 20 some odd days after they put it in there. I think the key thing to take home from this study is that, obviously this was in a laboratory setting. It wasn't in a real world environment. We've had other studies that were performed in real world environments that don't show anything close to this range of time that virus can be viable for. And in addition to that, we also have real world data available. And we just know now with epidemiologic data and other laboratory data that in general, touching an inanimate object and touching your eyes, nose, and mouth, while it certainly can transmit the virus, it's much less common than what we thought in, for example, March or April of this year.
I was doing just a little bit of reading on this study, and if you will, can we get in a little deeper into the science here in terms of laboratory versus real world settings? Because as a mom of a 1 and a 5-year-old, I was reading that there was mucus is an important factor. But it is, right? I mean, that's something that I would not have known before, and I find that scientifically very interesting. Can you explain why the laboratory, that's the difference between a laboratory study of this versus real world? How does mucus play
First
in?
of all, I love that we're having a discussion on national television about mucus being important, but mucus is important. Welcome to the wonderful world of infectious diseases. So, for example, if you take a hunk of virus and put it on a surface, like they used money, they used plastic, they used glass, they put it in an incubator, it was dark, there was no UV rays. Sure, under ideal circumstances, you could probably keep that virus alive for what it's worth and have, a virus capable of causing infection 20 some odd days later. But in real world environments, we know people, it's as gross as it may sound, this is what happens. People are coughing and sneezing, and the virus comes out of the mouth and the nose in hunks of mucus and lands on surfaces. The mucus has some enzymes, some proteins, some other things in it that will actually start breaking down the virus and perhaps making the virus less viable. In addition to that, in real world settings, there's ultraviolet rays around as well that help break down the virus. So in general, there's a lot of reasons why, but if we think about real world scenarios where we touch an inanimate object and then touch our eyes, nose, or mouth, it's just not a very common way to get this infection. It can certainly happen. People should not walk away from this thinking that we don't have to wash our hands. Of course we have to wash our hands. Of course we need to continue to wash down high contact surfaces. But I think what we can take away from this is that this focus on deep cleaning and wiping down every little micromillimeter of every surface for things that come into our house, it's probably a bit of overkill. And if we just keep to washing our hands and washing down high contact surfaces, we're going to be okay.
There will be people who will read the survival of 28 days, and that will spark some fear, the kind of fear we maybe felt back in March when there was so much that was not known. Is there enough new in this that it made you as a doctor say, I need to take a quick look here? I mean, the science is still unknown, right? It is still being discovered.
Well, okay, that's a good point in that there's still much that we don't know about this infection, and of course we have to be humble. But of course, in the same breath, we're 8 months in, there's been unprecedented attention, a global attention focused on this. There's been no shortage of research dollars poured into discovering more about this virus, how it's transmitted, how we can diagnose it, how we can treat it. So we certainly know something. And we know that this is a low risk way of getting the infection. So I think if we take a step back and look at how does this study alter or fit into what we do normally, it doesn't really change anything. We still should put a mask on when we go indoors because we know indoor environments are the more likely places to catch this infection, and masks will certainly help people that are infected with the virus It will help prevent shedding of the virus into the environment. We know that we should avoid crowded settings for similar reasons. We know we should keep our hands clean, and we know we should stay 2 meters apart. So quite frankly, this study is interesting. I think it's got some very good validity to it, and it pushes the envelope forward about how we understand this virus and how it can survive on inanimate objects. But at the end of the day, it doesn't really change any of the fundamental public health measures that we've been discussing for months.
And then just finally, I want to ask you, because again, in the reading that I was doing, one thing I did not know in terms of viruses surviving on surfaces is that the flu virus, by comparison, in those same circumstances, so the laboratory setting, but could survive for 17 days on a surface. That really surprised me. But again, I guess that's a laboratory setting, so perhaps that's why we're not talk as much about flu surviving on surfaces?
Yeah, I think your point is spot on. And in real world scenarios, we know the flu can certainly survive on inanimate objects as well. But I don't think anyone would be concerned in real world settings about catching the flu because you touched the doorknob that someone touched 17 days ago, and then you rubbed your eyes, your nose, your mouth. I just think obviously in medicine, just like in life, nothing's 100 or 0%, but the risk of getting the flu or COVID-19 in a scenario like that is getting close to 0%.
Okay, good. Well, you'll be pleased to know that I did immediately wash my hands, but I certainly appreciate your walking us through that.
Oh, my pleasure.